Other thing we are learning as we capture our data is how our communication has improved for just for pulmonary embolism. But as you can imagine, this might have a kind of a impact for all indications. But this is pulmonary embolism in ED setting. There has been 20% time saving for positive exams. That means we are communicating much faster based on the reprioritization. There is similar, we have seen also in inpatient and much higher time saving on the outpatient because outpatients are sitting for a longer time. So now what we did is when we had a backlog, one of our admin will go through positive exams for incidental PE or hemorrhage in the backlog, and then we will prioritize those exams first. So again, a great way to support your team and your referring providers and meet their expectation and mitigate risk of some of these incidental findings by appropriately using this tool. This is over time, as you can see, the quality enhancement for pulmonary embolism and incidental PE that, there has been 77% of QA alerts needed a addendum to the report. So, and over time, what we are seeing is this number is going down where we have to provide addendums because radiologists are increasingly looking at these tools and then interrogating the images if there is any disagreement between their observation versus the alert that came out from the ADOC widget. This is a data based on just the pulmonary embolism workflow. We have seen a substantial improvement in time to notification as well as time to anticoagulation. Here you can see these bars are pretty impressive, about 31 minutes improvement for notification and about 99 minutes improvement from the time to anticoagulation compared to pre-ADOC introduction in our practice using the historic data versus the data post-ADOC. There has been substantial improvement in communication and how when we treat these patients. So clearly a positive outcome that we desire. This is a dashboard, and with this dashboard, we can really analyze and create data per our need. It could be indication specific. It could be on patients who had PERT communication. We can look at also outcome in those, how many patients were treated with intervention, how many had anticoagulation. We can look at the data in aggregate. So there is a lot of functionality on this dashboard, which empowers my team, the QA team, to really look for areas where we have to make improvements and areas where we see clear opportunity with these tools. So really a lot of functionality built in, and it makes so much easier to interrogate the data, process the data, and then parse out the data to be more meaningful for future decision as well as for communicating with our referring physicians.